One of the topics I mentioned recently was about health insurance and sort of protecting yourself against major financial disasters, right? That's always our fear as we get older. How do we mm, how do we stay healthy, obviously, but also if we do fall ill, how do we protect ourselves from like a major financial catastrophe? There's all these horror stories and things that you hear about how if you as you get older in your 70s, 80s, 90s, you all of a sudden incur hundreds and thousands and millions of dollars of financial bills. When the reality is, as an informed healthcare consumer, you can curb that quite a bit. There are maybe a handful of things in medicine that are incredibly effective, a lot in the middle that is sort of unknown and maybe very individual, and quite a lot of things which are absolutely of no use. That's Western medicine for you. So I decided to talk about health cost sharing or cost sharing in healthcare or health care sharing ministries. There's a lot of different terms for these, so don't get confused. We'll just kind of go over it. I'll give you a brief overview, and I'm going to talk about some key players in this space. So one of them is Crowd Health. You can see here the website is joincrowdhealth.com. Another one here is Sedera. That's another big one in this group. Next is Christian Health Care Ministries, and I believe they've been around since the 1980s, so they're definitely one of the biggest players in this space. The next one is Samaritan Ministries. We'll talk about them. And there is Liberty Health Share, also a big one. Zion Health Share, been around for some time. And those are the main ones. Let me focus on these for now. There's a couple other ones out there, but the concept, the basic thing of what is crowd health. Here's what it's on this website they do a pretty good job of kind of explaining what everything is. Essentially, a group of us get together and we curb our risk in our own pool, which means that imagine 100 Dr. Mo's. One of us gets sick, one of us breaks a bone, one of us gets cancer, one of us goes to the hospital. And whenever these bills incur, we submit these bills to this company, let's say Crowd Health, and they immediately start negotiating with the hospital or doctor and say, hey, can we get a better price? Can we get a cash price? Can you itemize everything? Can we make sure that you're billing us appropriately? Because remember, I don't have health insurance, and cost sharing is not insurance. And so my $5,000 emergency bill suddenly becomes $1,500. And then we take this money and we divide it among the 100 people, the 100 Dr. Mo's. And so each of us pays a small portion. Now, the way they curb their cost, all these health cost sharing companies, cost sharing ministries or cost sharing companies, is they try to limit the number of people who are going to be already pretty sick coming in. So many of them are going to have limitations on how much you can weigh. Many of them are going to have limitations on certain things that are covered. Many of them are going to have limitations on whether you're a tobacco smoker. So a lot of different things. Not a lot, and we'll go over them, but they certainly have restrictions. So you can't just be maybe somebody who has a severe substance abuse problem or is a tobacco smoker or has severe obesity and then come in here and expect that you're going to get covered. You won't. And that information is fairly easy to uncover once they are about to pay your bill, right? So you submit your bill to them, and then they find out, oh, when you went into the ER, you were 305 pounds. Unfortunately, we can't cover that. Our limit is in nobody above 260 pounds. Things along those lines. And just going over it, the frequently asked questions in these things are always wonderful. The biggest fear people have is, what if Crowd Health just decides to not honor and not pay my bill? Well, they can't really do that. I mean, you sign a contract, and so you could take them to court. So basically, they will try to abide by the rules and regulations, but you're going to have to read those rules and regulations thoroughly. So we'll get into the cost a little bit, but here's one question: can anybody join? Here's some limitations based on past medical problems and how much you can and cannot weigh based on male and female guidelines that they have. Previous diagnosed conditions, for example, they might limit you for the first few months up to a certain amount. After that, they might cover it. What about, how does it work when they pay for certain events? So for example, they talk about, how a bill might come in and how it gets divided out amongst different people. And then they talk about the eligibility stuff, what is covered, what is not. Cosmetic procedures, long-term prescriptions, etc. are not covered. Now, that might freak a lot of people out. Like, long-term prescriptions is the American thing, but they do usually partner up with different pharmaceutical companies or pharmacies, and they try to get you really good prices on long-term medication. Now, this might become more complicated if you are on autoimmune medications. And for those issues, again, you're going to have to go in depth and really do your research based on each and every one of these companies, because they have many different types of price offerings, and that's on you to do the research. And I'm happy to you can run it by me, message me under this video, and we can just go back and forth. And you can certainly check out my channel, Digital Nomad Health, and if you become a member on my platform, you certainly would have access to me when it comes to discussing these things. The guarantee funding, that's again something I just discussed right now. What kind of doctors can you see? Pretty much any doctor. And vision and dental is another common question. Again, each company is a little bit different, but for the most part, you're going to be responsible for paying a certain amount upfront. So some people will have a $1,500 plan, some people will have a $5,000 plan. The first $5,000 is up to you, or the first $1,500 is up to you, and everything beyond that gets divided up. And essentially, when you think about it, that's really what health insurance should be. You want to protect against the worst outcome, the biggest risk. That's the goal. It talks about whether it's HSA or not, how medications are covered. So that's Crowd Health, very similar to Sedera. And when you look at Sedera, for example, if you look, many of these companies will give you a discount if you have a direct primary care physician. I'm a direct primary care physician. I'm a virtual direct primary care physician, but you get a pretty substantial discount. And when it comes to prices, most of them are pretty competitive. You're going to pay somewhere between $100 to about $300 a month. So for example, for a single individual, depending on how much you're willing to pay for your first bill that you might get, usually it makes the most sense to go somewhere between $2,500 to $5,000. You're looking at about $180 to $160. And as you get older, the prices go up a little bit. This is for the 30 to 39 range, but the prices really don't change that much. I mean, you're looking at $300 for somebody else. That's a little bit higher, but it's not substantial. It's not for the amount of protection that you get compared to health insurance, which is much more complicated. This can make a lot of sense for a lot of people, especially when I have friends who are in their 70s and 80s and they're paying well over $1,000 for health insurance. Again, here with CHM, so Christian Health Ministries, they kind of break out the prices. So if you're willing to accept a bronze plan versus a gold plan, you can pay a lot less. But certain things may or may not be covered, and you have a certain amount per illness. So for example, if I go and break my neck for that illness, only up to $125,000 might be covered. So these are some of the things to keep in mind. But again, read the details, because I'm not telling you that's how it is. There might be a lot more nuances there. So it's worth reading the details. I thought Healthcare Ministries had a really good FAQ. Most of these do not require you to be a Christian. Some will require you to be a Christian, and not only that, they ask that you go to worship regularly. Many of them will not cover abortion. Some of them will, so that's important to keep in mind. So again, really good information on their page here. When it comes to Samaritan Ministries, again, very similar price point. If I go further down, you can see for one person, somewhere around 126, 147, 168. Again, not an insane amount of money, but it does discuss pre-existing condition. It does discuss what's covered in routine care and prescription care, especially maternity care. Some of you guys, I know some of you expats are quite concerned about that. But as I've discussed before, maternity care can cost very little in other countries when you pay cash, so consider that. Liberty Health Share, also very similar price points, so not really worth discussing. Again, all of them are a little bit different. libertyhealthshare.org, many of them will have the same requirements as far as they want you to be healthy or have a certain health baseline before you come in. And if you're willing to pay more, your monthly cost is going to be a lot less. Now, what this cost usually will break down into like $50 a month just to be a member on this platform. And the other $53 is essentially what you would pay towards another member's health concern. And it will never be more than $103 a month. So for 40 to 49, it can be up to 169 or 213, and if you're above that age, many of these will not accept you if you're over 65. Absolutely, some of them will, and again, it's worth doing the research and finding that information out. I mentioned the direct primary care thing. I think if you're part of a direct primary care, the health savings is totally worth it. Some of the ineligible sharings that are worth discussing. For example, I just pulled up Zion Health is one. ADHD. Obviously, that's fairly straightforward. Even if it's not covered, doesn't mean you cannot get ADHD care. You just go and do it on your own. Allergy treatments, dental care, certain diabetic medications and supply, especially long term. Some of them will not honor that. Medication non-compliance, if you have a side effect from not being non-compliant. Obviously, they want you to be a very good patient. I thought sleep apnea was kind of interesting, but I guess it makes sense. They want a healthy base of patients. That's certainly logical. So I hope this is helpful. If you have any questions, leave it in the comments below and I will respond. All right, guys, take care.